Well, during the pandemic, we were seeing a huge increase in prevalence of anxiety and depression. And our patients were telling us more and more that they were having trouble getting in to see someone, even establishing care for the first time. So, in hearing that, we kind of collaborated with our team like, what can we do to help these patients along the way? And for us, it's a little troublesome because we're managed care patients contractor, and most of our patients are carved out. So, we're actually sending these patients elsewhere for behavioral health care services. So, what could we do to help these people while they wait for behavioral health care? So we have a number of existing text messaging programs. So we already have a contract in place with a vendor that we've worked through with many times in developing the content. So we reviewed used the guidelines to review assessment questions, how we could use them to get information from patients, and that helps direct the text messages that go to the patient. So if they feel confident or know a lot about their diagnosis, we don't dwell on it. We move on to tips that can help them self-manage their anxiety or depression, and then we give them tips and tricks to help themselves along the way. We had a bi-weekly collaboration with the team to develop the program to come up with really a curriculum. So, we move through the curriculum. It's about an 8-month program. People get 2 text messages a day, educational motivation materials, and they can respond. And we have a team that monitor a dashboard. So as the text messages come in, we can respond if we're able to, or send them to the social worker if it needs to be escalated to them for a response. We've seen great outcomes. The first year we enrolled over 200 patients, and we've enrolled over 150 this year. So we're getting close to 400 patients participating in the last year. The outcomes have generally been good. Patient satisfaction score of over 4 on a 5-point scale. Patients have liked the tips and the way they can use behavioral activation to associate, things they do in life to better mood and help repeat those over time. That's been one of the big parts. And we've seen other people say that, they're happy to have a text messaging program where it's there if they need it, but they don't really have to talk to somebody if they don't feel like it. So it's been a great way to meet patients where they are, give them help when and where they need it, and encourage them to seek counseling or whatever's best for their situation. Well, there's one question about, how well anxiety or depression, and if they know a lot about them, we steer the content. So we actually have different content frequently for whether they have anxiety or depression, and that helps them get the right information they need because the correct diagnosis can make a lot of difference in certain instances. So we'll ask them that question ahead of time and how much they know about their diagnosis so we can steer them to the right education and tips. One of the questions too is there someone you can go to when you're experiencing, when you need help? And that's another one that's good to ask patients so you can refer to it later if they say they're having trouble right now. It's like, oh, remember you said you like to talk to your friend when you're experiencing issues. So even if you don't refer to it, it's great to plant that seed in the patient's mind that there is someone they can reach out to when they need help in the moment. So you ask these questions along the way, and then you vary the content based on their answers to their questions. So if they know a lot about their diagnosis, you can say, great, it helps to understand what your problems are so we can focus on a solution. And if they don't, the content can automatically send more information describing the diagnosis and what that means to them, or it can skip to the next module, of learning in the curriculum. So that helps out in a lot of ways, and then the messages are more tailored towards the person's needs. So it spends more time telling the patient things that apply to them, and less time on things that don't. So that keeps the engagement in the patient as more messages apply to their situation. We're seeing that of the people who enrolled in the program, about 85, 86% of people actually text back actively. So if we send them a quiz or a survey to ask them questions that might direct the content later down the road, or even ad hoc messages just like, hey, thanks for the tip. I'm glad you're here if I need you. 86% of the people enrolled are responding to stuff we send them, which is great because it's illustrating they're paying attention to the messages, right?